Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. We are from Anesthesiology nursing. We will explain a little bit of nursing care of plan that we already made yesterday. My friends Ratri Wulandari will explain it to you. Here we go.
Okay, thank you, Atika. Case. Miss D complained of abdominal pain with scale 7. It was kind of squeezing pain that circled in her entire abdomen. She also vomits once, had body stool, constipation, and there was a lump in the lower of abdomen. The patient was in composmented state. Blood pressure is 120 per 80 and pulse is 60H. Respiratory rate is 24 breaths per minute. Temperature is 37.5 Celsius. Bowel peristaltics is 14 times per minute. And abdominal palpation showed that there was a pressure point and lump in the lower abdomen. The result of blood test, hemoglobin is 11.3, ORM is 50 milligram, and creatinine is 1.2 milligram. Case review. First, chef complaint. Miss D complained of abdominal pain with scale 7. The story of recent illness is she also vomits, had bloody stool, constipation, and there was a lump in the lower abdomen. Post-medical history is the patient had never been examined before, and family history is no hereditary diseases. Physical examination is composmented stage. Blood pressure is 120 per 80. Pulse is 60H. And respiratory rate is 24. And temperature is 37.5 Celsius. Bowel peristaltic is 14 per minute. Abdomen palpation showed that was a pressure point and the lump in the lower abdomen. Additional data, the result of blood test is hemoglobin 11.3 gram, ORM is 50 milligram, and creatinine is 1.2 milligram. Next. Data analysis. First, data analysis is subject data. Miss D complained of abdominal pain. Sorry, take slide. Nah, yeah. Miss D complained of abdominal pain with scale 7. Objective data is the patient look in pain. Blood pressure is 120 per 80. Pulse is 60H. Respiratory rate is 24 and temperature is 37.5. Bowel peristaltic is 14 per minute. P is lump and qualitas pain is squeezing. Regional pain in anterior abdomen and lower abdomen. Scala pain is 7 and time pain is continuously. Problem is acute pain, and then etiology is lump in lower abdomen. Next. Subjective data is she also cited death vomit, had bloody stool, and constipation. There was a lump in the lower abdomen. The patient has been deficit for 5 days, and the data objective is weight loss 2 kilogram, distension abdomen. Blood pressure is 120 per 80, pulse is 68, respiratory is 24, and temperature is 37.5. Bowel peristaltic is 14 per minute. And then problem is risk for imbalanced nutrition. Etiology is patient cannot fulfill nutritional needs. Okay, next Atika.
Okay, so I will explain about nursing outcome. The nursing diagnosis is pain related to tumor abdomen with expected outcome is after doing nursing implementation 4 times, we will reduce the client's pain from 7 to 5. And the rationale is to reduce client's pain. The second nursing diagnosis is risk of imbalance nutrition with expected outcome. After doing nursing implementation, patients' nutritional needs will be fulfilled. And the rationale is to fulfill patients' nutritional needs. So next is nursing intervention. Expected outcome is patient will say that scale of pain will be lower. With nursing intervention, check patient vital signs, suggest patient to take deep breath 3 times, and collaborate with doctor for giving analgesics. And the rationale is to know patient's vital sign, to reduce pain with non-pharmacological way, and to reduce pain with pharmacological. The second expected outcome is patient will say that she not vomit. Nursing implementation is check patient's vital sign, check patient's nutrition history, and suggest to eat with small portion in many times. For the rationale is to know patient's vital sign, to know the causes of imbalanced nutrition, and to fulfill patient's nutritional daily needs. So that's from us. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.